Thank you, Adriana. Thank you very much. And now I would give the microphone to Stephen from Nigeria, which will actually give us a perspective of the situation in one representative sub-Saharan African country, what may be the main issues they are facing, needs. Stephen, please share your screen, unmute yourself. And if Dr. Popoola want to add something, please feel free to do so. But first you have to unmute yourself and share your screen. Thank you. And while they get ready.
I think Popoola, we want to start the presentation, and then I can add some few words.
I can share it if you like.
Yeah, please go ahead.
Okay. Okay. So let me.
Major implications in.
Okay. So I'm sharing this now. And just please tell me when you want me to change your slide, okay?
Yeah.
Thank you very much for the opportunity to talk about.
So Popoola can go ahead with a few slides, and then I can just add some clinical perspective.
Yeah, so good morning, good afternoon, everyone.
We cannot hear you well.
Dr. Popoola, we cannot hear you well, I'm afraid. Can you do something to your microphone, increase the volume?
Hello, can you hear me better now?
Not too good.
Can you hear me better now? Hello?
Hello?
We need you louder.
Is it better now?
Not really.
Oh.
We are late.
Okay.
Good.
Good now.
Good.
All right. So this Oluwatoyin and Professor Oluwatoyin from the University of Lagos, Nigeria. So that can you just go to the next slide?
It's okay, but nobody is not here.
Next slide.
Some of your application.
Please try to proceed, Towen. Thank you.
Hello? Can we go to the next slide, please? Hello? Can you hear me now?
Yeah.
Okay, so can you go to the next slide, please? Okay, good. So these are just some of the, solutions that the public have really come about because there's a scarcity of the medical mask. And people got creative and started thinking of how do we make this thing reusable and then affordable. So those are two key questions that help people to, or that is driving what people are doing. At least having something is better than nothing. At this time, of course, all these materials that are used are not tested. So there is really no testing, laboratory testing of these materials going on. But at least this can protect however little. Yes. Next slide, please. Next slide, please. Okay, so the key issues here, previous slide. Okay, so we see that the main issues for testing, people don't have laboratory tests for those materials, but there's the rule of thumb test, which is you try to extinguish a burning match or flame with the nose mask. If it does so easily, then it's not original. And if it does not, then maybe the quality is good. So the concept is to wash, iron, and reuse. And that's what many people have in mind because you can't deal with replacing one-time use masks. And of course, the NCDC, which is the Center for Disease Control, has advised the public that wearing of nose masks is just an additional layer to social distancing, physical distancing, and hand washing thing. Looking around, compliance is not really total. A lot of people do, but that numbers still are not compliant for different reasons. But here are some of the key challenges. Now, a lot of people don't use the mask correctly, and there needs to be awareness on how to properly use the mask. The choice of material is also an important thing. A lot of people use all kinds of fancy material, although the most common is the cotton fabric, which we call Ankara in the local language. And there's some local manufacturing that is going on using PVC pellets and so on. So there is also the challenge of the proper design for the nose mask to make sure it's properly covered. That is not, a lot of people don't know. And then, of course, we have some local manufacturing capacity in some of the states, Lagos, Cross River State, and Abia State. So there's a key problem, which is the shortage of PPE among the frontline health workers. So I think let's go to the next slide, and then Professor Stephen will take it up from there. So there's a brief business, people are creatively selling, but this is also potential risk because it can also spread even from this and see the way it's been handled. But the government is making all efforts to enforce that nose masks are used with a punishment if you don't use those. So Professor Stephen, over to you, sir.
For the critical PPE that is mostly used by the frontline staff, there is, for now, no local production in Nigeria. The supplies are not enough yet. The incidence of COVID-19 is increasing almost on a daily basis. Kano has joined Lagos as an epicenter. Most of the PPE supplies are primarily and majorly from the government, and these are distributed to isolation facilities and to testing centers. The sources are primarily from the international donors. Of course, the situation at present do not allow verification of quality apart from regulatory clearance. The Standard Organization of Nigeria, the NAFDAC, are responsible for all medical devices that comes into the country, and the quality of those devices. The Medical Laboratory Science Council of Nigeria is responsible for IVDs that comes into the country. So the end user depend on these regulatory clearances. Situation, of course, do not allow individual verification of the quality. So because of the daily surge in the incidence of COVID-19 in Nigeria, there is an high tendency for recycling, and some of the local innovations are for people to wear disposable gown on the PPE so that it can be disposed while the PPE can be reused. And that is also done for the N95 face masks. The cheaper surgical face masks are weared on top so that that can be disposed regularly within protocol. And even the complete gown, sometimes there's surface recycling lab coats that I wear on top so that that can be disposed, while the original PPE can then be recycled. These are some of the innovations that are going on, but at the same time, there are also research and activities from industry going on to start local production. But for now, there is no local production in Nigeria. Thank you.
Thank you for this clear and effective presentation. I think it's important that we facilitate the communication also from countries which are not every time providing input to this global discussion. Okay, so this was our last speaker. I have seen already a lot of questions coming through the question box, and many have been already answered in real time by panelists. So please keep putting your questions here into the chat box, because now we can open, and I invite all the panelists to open their microphone and feel free to answer to those questions. For instance, there is a